That's it.
All right. So should we move on to the PLAB 2, and how do we go about it? I just wanted to, I think I already mentioned, I think we are not, I mean, we're not trying to advertise any academies through this. I just wanted to general advice around how should a person go about PLAB 2, what sort of things they should look for, and how to improve your chances. And the common mistakes you've seen, you must have, because you've done PLAB 2, you must have seen your fellow colleagues struggling to pass that same exam, and you must have an idea what are the common mistakes IMGs are making. So should we start with let me start with Dr. Anush then, that around his advice on PLAB 2, and if somebody's already passed PLAB 1, how should they go about it?
Well, in this current scenario, I think getting a date for PLAB2 itself is a huge headache,
Yeah.
and that causes a lot of stress. So most of you guys are concentrating on getting the date, fighting for dates, and you're lost in, securing a date that you forget that you need to prepare for the PLAB2 exam as well. Because PLAB1 is something which is basically subjective in the sense you prepare for the exam, you clear the exam, and it's just the objective questions you answer and you clear it. But PLAB2 is more than that. They see the interpersonal skills, how you perform yourself, not just as a doctor, but how you carry yourself as a human being, how empathetic you are to the patient. Most of the times in these exams, we are so lost that, you're concentrating on how to clear the exam. We don't even bother about how the patient feels. So that's more important in a scenario in PLAB or in UK, whatever, that you have to play a role, not just as a doctor, but as a good human being as well. Try to understand the emotion. Sometimes, there'll be a scenario or a case in the exam where they're not expecting you to solve the problem. They're expecting you to be empathetic to, or, understand the situation of the patient and try working around it. Like psychosocial factor, they want you to resolve that. So this preparation itself is challenging and daunting if you're coming from a culture or from a system which is different to the United Kingdom. Because here in United Kingdom, they are trained day in and day out. The minute they and finally they start attending the hospitals and clinics, they see that, they learn, they pick it up from the consultants or the reds or the junior doctors, and they'll be like, oh, this is how I need to do it. Whereas back home, be any Asian country or most of the African and Asian countries, it's taken for granted that patients should listen to what you're saying. You don't really, want to listen to what the patients are saying. So these are the factors which also, play a role in your preparation. And it's more of interactive thing, not learning your subject, but interacting with the other person. So there are various, academies which train and teach you how to do all of that. But the most important thing, once you secure a date, you need to have at least like 4 to 6 weeks of preparation before that, before you give an exam. Acclimatize yourself to the system, what they're expecting, and how you can give your best. Once you know that and keep repeating it, practicing with partners, whatever, whoever are doing the same exam, you can keep doing the mocks, and then only with practice you get better, and you can understand what's expected in United Kingdom or NHS, and you can do your best.
So I'll go to Asan next. Asan, what is your advice to the PLAB 2 candidates?
Well, PLAB2, as my colleague just mentioned, getting the date is the most arduous task these days. And I mean, I remember a colleague asking me to book the exam for him from the UK because he thought it would be easier and faster for me to book from here. But starting from get any date that you can, it's very competitive these days to get a date. And when you have gotten a date, you have to decide on which academy you have to choose. I won't be mentioning the name of any academy, but you have to, there are certain features of each and every academy. Like there's someone who has good interpersonal skills, you can choose the academy based on that. Someone who's good at history taking, you can choose the academy based on that. Next step is to choose your academy and the visa process. Regarding the PLAB exam, I usually divide it into three. The first step is history taking and examination. That's one part. The second part is management. And the third part is your interpersonal skills. All of those are equally divided. All of those have 4 marks. And usually you pass the station if you score 6 to 6.5 marks. So even if you Everyone will be doing the same things. Everyone will be taking the history. Everyone will be doing the examination. It's more your interpersonal skills that are going to make a difference on the day of the exam. And that would be the difference between someone who passes the exam and someone who scores a little less than the pass mark. It's not what you ask, it's how you ask. It's not what you do, it's how you do. And that is the difference between someone who passes the exam easily and someone who does not. I think PLAB 2 is an easy exam. It depends on your preparation and how much time you put into it. I would say take an academy of your choice. After the academy, mocks are very important. To give the mocks because they tend to open you up, they tend to improve your interpersonal skills, and they kind of give you a guideline of what to follow and how to do stuff. Because clinical practice is different from where we come from, and clinical practice is different here in the UK. So just work on it, improve your interpersonal skills. We would all do the same history examination and management. Uh, so yeah, interpersonal skills would be what I would focus on the most.
Mohammed, would you like to add something to this advice about PLAB 2, and how do you advise your fellow IMGs?
Yes,
You,
yeah. Starting with very good time after booking the lab to date, because visa will take a lot of time and a lot of effort. You may feel exhausted after it, so spare a few months before the date. After this, second advice, it has been a lot of cases that increasing or the notes and the cases increasing every year and every month. So around maybe 400 or 300 cases that came before. So not to go to UK before reading all of them and practicing them. Um, Already because of COVID now, there is a lot of limitation regarding the UK stay. So it has been better to practice online and also maybe practicing live practice with your friends in the same country. It has been available now. So my advice, third advice, is not to delay or postpone the practice
yeah.
of the station. Most of us may think that I will read all the station first, and after finishing them, I will start practicing. This is big mistake. If you go to the exam without practice, definitely 99% you will fail. Okay, but the opposite is correct. If you don't read all the station, but you practice and you develop your interpersonal skills, how to deal with the patient, you will pass, even if you don't know the case. My my first advice is to be adapting your your brain about some issues. The first thing you will sometimes you will be messed up in one of the cases. Don't panic. Just go with the basics, the history and the interpersonal skills. Ask the patient about his issues. Always in every station in the exam, you need to ask the patient about what he think, what he expects from you. If you do this, he will guide you. He is in the same line with you. He doesn't come to make obstacles in front of you. But what already occurs usually, we don't ask them. We don't ask them about what is in their mind. We always giving the management without taking the consent or if this suits him or not. So in every station, ask the patient about what he think, take his consent, ask about his mood and psychosocial. This will give you, an easy mark and save you from fail. The second is the last thing. If you fail, and we hope this doesn't occur, don't get down. Uh, Take your time, okay, but make sure that you have come all this way and you have passed the visa islet and the visa process. So just to try to find the weakness, took a lot to other friends who passed. Um, it will come to know that is where is your weak point, and you will work on them.
Oh, thank you. Naman, if you want to add something to the PLAB to advise for your candidates.
Yeah, well, I have a lot to say about PLAB 2. So basically, when I had my PLAB 2 in March with Ehsan, it just got cancelled. So the thing is that it's really frustrating when you don't have a date, and I've been through that time. So I would advise that if you're not getting a date, you can just have a support system. You can just make a group of people who are like studying for things and just keep in touch with the material. It's all very volatile. If you'll not study, you'll just forget things. So what I did, I made a group of, like, it's still, I even made a channel on YouTube. It's called Daily Stations. I've discussed all these things in very detail, but I'll just summarize the main points here. So the first thing is about the academy. Every academy is fine. Every academy is somehow teaching the same thing. And it's a very subjective exam. So first of all, you have to identify where you are lacking. You have to find out like where you are in the 3 domains that we have in PLAB 2. And choose the academy according to your convenience. Because all the academies are same somehow. So if you are, for example, there is a XYZ academy and you have got some relatives there, some friends there, you're living there, just go for that academy. I attended it in Pakistan because I had academy available there. So just choose it according to your convenience. And all other things, I do agree with my colleagues. And the practice thing is very important. You have to practice again and again. Interpersonal skills are very important. And study smart. I would say this is one thing, that you have a lot of categories in PLAB 2, like you have ethics, counseling, medicine. So start with those categories which tend to come more. Like what we do is that, first of all, everyone is starting from medicine. There are a lot of stations from medicine, and normally you do not get much stations from medicine. The most of the stations you will get in PLAB 2 will be from ethics, from counseling, how you deal with an angry patient, how you deal with a demanding patient, how you tackle different scenarios. So I would say that initially when you start your preparation, start with those categories. So you do them very well, because the chances are that you will get 2-3 stations in each category. Then after doing that, then you do the those categories which have less stations. For example, then do the psychiatry. You will get chances are that you'll get 1 station from psychiatry, and I think there are not much stations from psychiatry. So do psychiatry, then do the peds, then do the obs gynae, then do the medicine in the end. However, but it's a trend that normally you'll get more stations from what I've mentioned. But then just group the stations. For example, if you have a lot of stations in medicine, then group together according to symptoms. For example, for example, you pick chest pain, so do all the stations related to chest pain. You have shortness of breath, do all the stations from that category. So that way you'll do it easily. And the next thing is that do practice. It's very important, because you tend to forget things because of panic in the exam, and if you've not practiced well, it can go bad. So that's all about from my side. Yeah.
I'll ask Dr. Daniel, then I'll come to Sana. Dr. Daniel, do you have any advice around PLAB 2? I think maybe he's away from the screen. Sana, do you want to give your advice around to the PLAB 2 candidates?
Oh, yes, I have a lot to say because I just gave it a month back. So I really have a lot to say. So let's start with your common questions. How many months would it take me? So the answer is that it could vary from person to person, but my exam got cancelled over the past year, but I would say 3 to 4 months are good enough. Nowadays, you're getting a lot of telephone stations. So what to do about that? Telephone stations are not any different from the main and normal stations. It's just that now it's a telephone in front of you and not a person. But remember this, the way you move your hands, your gesture and everything, it's been recorded by a camera. So nothing changes. The only thing is the patient is not sitting in front of you. That is it. So don't be scared about the telephone stations. It's nothing new. Okay, I will also cover how the exam has changed during the COVID period. nothing has changed. Only the I got 16 stations. Okay, there were 18 stations, 2 were rest stations, and then there were 16 stations that you have to wear a mask throughout. The exam. So the patient is like sitting right like far away from you at the other end of the room. You're wearing a mask, and but the patient is not. So it's very easy for you to see the patient and sort of catch their emotions and everything. Try on sort of because you're wearing a mask, try on sort of, you can still emote basically, so try using your hands and your eyes and things like that whenever you need to emote. So that's one thing. How has it changed otherwise? There hasn't been any other change, honestly. Okay, another question is, why do people fail when everybody has notes and everybody has academies and everybody has so much of guidance? This is not the first platform where people are sitting and talking about PLAB 2. Then why do people fail? The reason is because we all are running in a race. Okay, so what we do is, okay, fine, pass PLAB 1, now I'm going to book PLAB 2 and apply for visa and then join an academy in this and this and this. I was the same person. I did the same mistakes. But if I were to go back, there are a few things that I would change in my journey, and I would suggest you guys to do the same. So the first thing is, do I need an academy? No. Honestly, this is my opinion. You don't. I would rather say the notes are available. NHS.uk and NICE are available. Make your own approach to stations. You know they're looking for 3 things. One is the data gathering, one is the management, one is the IPS. You have IPS videos available. For data gathering, you can make questions by yourself, and for the management, you have NHS.uk available. You only need notes for the station as to like what stations are coming and things like that. Having said that, the second thing, what is the other thing that makes people fail? It's your nerves. Inosh, I practiced with Inosh actually. Inosh once told me this, and this has like stuck into my mind. Inosh told me, Sana, just calm down. You're not a medical student, you're a doctor. You know it. And that is the last thing I told myself before entering the exam, that I am a doctor. I see these patients every day. I'm not a medical student. I know my stuff. And when I went there, I was a doctor. So what they did was they changed the scenario. The patient reacted differently, but I because I wasn't going through a learned approach, a scripted approach, because I was a doctor and not like somebody who's memorized scripts, I was able to adapt. Okay. The other thing is practice. Practice as much as you can and practice with different people. And the game changer is practice with those who know. So for example, you are going for the PLAB 2 exam and your friend is going for the PLAB 2 exam. You can do the first read with them. You can practice for the first time with them, but please don't do the second read with them. Don't do the second practice with them. Do it with somebody who's passed the exam. Go for those who know what the exam is like, because I have seen this out of my experience. People fail and fail and fail because they cling on to the same study partners. Don't do that. I learned from Inosh because Inosh had passed the exam before me. I practiced with Mohammed because I did my first read with Mohammed and then second with Inosh because Inosh had passed the exam. So, these are things like that. Those could help you. Be natural. Be natural. When the patient is crying, slow down. When the patient is laughing, smile, laugh with them. When the patient says something, when the patient is angry, reflect, sympathize. What we do is, because the timer is running and the bell is going on, we're like, no, I have to finish it. I have to say everything that I want to say. Trust me, guys, there were stations where I couldn't complete them, but because I took it according to the pace of the patient, I passed those stations. So do it like that. Give your patient importance and time, just exactly how you would do in a real life scenario. Do I have any other more points? No, I don't. So yeah, but again, I would say learn from those who have passed and don't run in this cycle of, learning from those who know just as much as you know, and then you both are like, now what do we do together? So yeah, that's my advice for you guys.
I think there was a question on a lot of people were asking about UK MLE. There are a lot of people asking about. I mean, I only know what is on the website that GMC is putting on. They've been talking about bringing this newer format of exam for some time. but we just have to wait until they do it, because they keep postponing it, keep putting the date forward. So I think we just have to have to follow what GMC is saying about that rather than giving our opinion, because we don't really know more than anything that what GMC has already told us. Is there any other question, Sana, which you have seen for the PLAB?
No, I think we have pretty much covered everything as far as PLAB 2 is concerned. And people are asking about finances and everything, but I think we're going to cover that in the visa process.
Yeah.